welcome to Wundia's Corner YouTube channel. This is Oluwatomiyin Logo. In case you're just joining Wundia's Corner YouTube channel for the very first time, I film life, relationship, health, family, kitchen, travel, faith, and so many more. Last week on my last video, I said I'll be answering questions today. The questions asked by my followers on LinkedIn, which inspired my last video, and today also their questions inspired this video. Yes, what are the questions? They asked 3 questions which I am going to combine together to answer today's video. Number 1 question is the responsibility of a healthcare assistant in the United Arab Emirates. And number 2, they want to know my daily responsibility as a healthcare assistant with the American Hospital Dubai. Number 3, they want to know the salary range of a healthcare assistant or certified nursing assistant, whichever one you want to call it. They are both same thing. So I'll be discussing this in my video today. Now let's start with this. Traditionally, I think the responsibility of healthcare assistants and certified nursing assistants worldwide is the same. If you walk up to someone, or if somebody walk up to you and ask you what is your job, and you tell them I work as a healthcare assistant or nursing assistant in a hospital, what comes to their mind is that, oh, this person is in charge of observing, monitoring, and taking record of patients' healthcare routine. You are in charge of checking patients' height and weight. You are in charge of checking their pulse, respiratory system, checking their temperature, and everything. And I think this is the first or primary responsibility of a healthcare assistant before other duties or responsibility comes up, such as COVID PCR test swab, patient ECG test, patient blood collection for sample that we all know as phlebotomy, urine analysis test, glucose or sugar test for patients, dressing of the wound for patients, assist with basic clinical responsibility in the clinic or in the hospital, and patient personal care. These are the responsibility of a healthcare assistant or certified nursing assistant in a clinic or in a hospital. You are in charge of changing bed linens, changing pillowcases in the hospital ward or room, feeding some patients that are not privileged to feed themselves, that are sick or something. As a result of this, my responsibility daily goes like this. In case you see me looking down, I'm just checking my jotter to guide myself so that I won't forget some things. All right, I am in charge of checking the medications and nutrition refrigerator morning and evening before the clinic where I work close. Okay, that is all the refrigerators where medications are kept, where drugs, whatever we call it medication. Here in the United Arab Emirates, we call it medications. All the refrigerator where medications are kept, I am in charge of checking if the temperature of the medication refrigerator is working perfectly well, and the refrigerator where all nutrition, food for patients and for the staffs are kept, I will check also if they are working perfectly well. I also check the refrigerator where samples are kept, whether COVID sample, throat swab, blood collection samples are kept, to make sure that the temperature are working perfectly well. And if they are not working well, I have to call the biomeds to come and check it. I also do room check to change the bed linens and also pillowcase, change the couch roll on the bed and fix it if they are not well fixed. Check the consumables in the room and refill them. On the consumables, you have to check also for the expiry or expiration date on the consumables. Those ones that are close to expiry or near to expiry date, you have to put a sticker of near expiry sticker so that anyone, whether the physician or the nurse who wants to use it, will know that these are near to expiry and we should use them first before we use those ones that will expire next year or in 2 years, 3 years time. Okay, and immediately after every procedure, procedure in the theater or in the procedure room, I will be the one to clean it. And then I would change the bed linen, change the couch roll, change the pillowcase before I would go outside to call the housekeeping team to come and clean the non-clinical, to come and do the deep cleaning on the non-clinical area of the procedure room. Before the close of the day, I'll make sure that I clean all the equipment, plug in all the cables of all the plug of the equipment into the electrical socket, and make sure you get them prepared for the next day. Check all the vacant or free rooms prepare all the beddings and all the sheets and all the couch roll for the next day, refill the consumables and prepare them for the next morning. And for the materials that are close to expiry, that are like 1 month, 2 weeks near to expiry, we have to communicate with the materials team by mail or by call. It is better by mail. Most of the time I do it by mail. I communicate with them by mail to tell them that these materials are close to expiry and I have taken them out of the store for returning to you, the material department in the main campus, which happens to be our main hospital. So they will tell me, oh, just hold on, keep them aside, we will return it. We will give you new one that are far from expiry date. Then once you receive that, you can return the one you kept aside. Also for the medication, check with the medication lists, check medication checklist with the assistance of a registered nurse or a senior registered nurse. We will check the near expiry medications. We will put a red sticker with the name near to expiry. I'm going to be showing them on this video. So we'll put sticker near to expiry on the medication, so that all these medications would be like 3-4 months to expiry, not like 1 day, 2 days, 1 month, 2 months. Okay, we have all this near to expiry I'm talking about are 3 months to expiry date, but we have to take them away according to the rules and regulation of Dubai Health Authority. So we are going to put a sticker on them in case we don't have a replacement yet. We'll just put a sticker until we get a replacement for them. And also for the look-alike, sound-alike medication, we'll put a sticker with the name look-alike, sound-alike medications. We'll put it on them so that in case of emergency cases, the nurse on duty would know that this medication I'm holding has a sticker of look-alike, sound-alike, and I have to look at the name of this medication to be sure that I'm taking the right medication. Okay, I do this with the assistance of a medical registered nurse or a senior registered nurse. Lastly, for the high alert medications, we go to the cabinets where high alert medications are kept. We make sure that stickers of high alert medications are pasted on each medications, even if they are 100, 200 or more than that. Each of them has to have a sticker of high alert indicator on them, so that even if a nurse that was on duty yesterday is absent today, any nurse on duty today would know that this medication is a high alert medication and it has to be handled with care. You don't have to make mistake. So to avoid this, we have to put a sticker that is written high alert medication on the medications to avoid story that touches the heart. Lastly, about my responsibility in America Hospital Dubai, I work in team with the registered nurse during any sample collection from any patient. I work in hand to hand with them to, after they might have collected the sample from the patient, I get the LIS sticker, which have the name of the patient, the date of birth of the patient, the name of the patient in full, the 3 names of the patient in full, their medical record number, and the date of birth of the patient, which will be stick on the sample, on each sample of the patient, including the name of the nurse, the registered nurse who took the sample, and the time the sample is taken and the date which the sample is taken, so that there will not be mix up. There are some times that you have patients who bears the same name and they are not from the same place, so the 3 names has to be there in the LI. So the full 3 names of the patient has to be there to be sure that you don't make any mistake in this sample collected for any patient. All right, and this has to be done before any sample would be sent to the lab for investigation. Or basically, these are my responsibility in America Hospital Dubai. But now the good news is that I left Dubai already. I relocated to the United Kingdom for something very important. In my next video, I'll be talking about my relocation to the United Kingdom, what I am there for, and we'll be giving you updates as it unfolds. So the last question is about the salary range of a healthcare assistant in the United Arab Emirates. But let me tell you this. In the United Arab Emirates, you are paid based on your nationality, you are paid based on your certification, you are paid based on your years of experience. So salary range of a healthcare assistant in the United Arab Emirates start from, is between 2,000 dirham to 5,000 dirham. You know, there are some people that they have diploma in nursing. There are some, but they are not registered. There are some people that are graduates. You know, they have degree in nursing, but they are not registered yet. So everybody work as a healthcare assistant. So this is why I said it range from, and also they consider some nationality to nationality. Talking about the nationality is something that really pains, like it's like a pain in my bone or in my heart. I don't know how to say it. You know, there are some people that have diploma in nursing. There are some people that graduated, they have their BSc or whatever in their degree in nursing, but they are not registered. All these people work together as a healthcare assistant, and there are some people that do not even have more than a certification, 3-month certification in the United Arab Emirates of a CNA, and they're collecting 3,000 dirham, 5,000 dirham, 4,000 dirham. It all depends on the organization, the Emirates you're working, and also the kind of visa you're working with. If you're working with their own visa, your salary might not be more than 2,005, and if you are an African nationality, you may not be earning more than 2,005, 2,000 dirhams. But if you have your own visa, you might be earning up to like 4,000 dirham. It depends on your emirate. I hope I have answered your question today. In my next video, I'll be talking about my journey to the United Kingdom, what I am here for, and then what you need to know about the United Kingdom. It is good to work in the United Arab Emirates. I love all my staffs. I love all my colleagues, my senior colleagues. I will surely miss them, okay? And I will be showing you my resignation and send forth party from the America Hospital Dubai in my coming video. All right.